One of the most exciting new areas is if it gets out of the prostate, if it starts to spread. In the last 5 years, there has been major breakthroughs in the treatment for advanced prostate cancer. We have 5 or 6 new drugs that are available, and we have 5 or 6 new drugs coming. This area, it's incredible on how we have changed the face of urology or the treatments for advanced prostate cancer. Month to month, year to year, this area is exploding. It's incredible. So that we're trying to get advanced prostate cancer so that we can make it a chronic disease. Unfortunately, today, we can't cure advanced prostate cancer, but we have 6 new treatments, 6 more coming. The goal is to make this a chronic disease, eventually make it a cure. But we're not there yet. We want to make it a chronic disease similar to diabetes. We can't cure diabetes, we can't cure hypertension, but we can give you pills and treatments to control it. And that's kind of where we are today with advanced prostate cancer. Advanced prostate cancer is, again, if the prostate cancer leaves the prostate and goes into the bones, the lymph nodes, the liver, the lungs. Usually it's the bones or the lymph nodes, but it can theoretically go anywhere. Less commonly the liver or the lungs. Usually goes to the bone and lymph nodes. And that's what I'm going to focus on, and that's the hottest area of urology today. Typically, if the prostate cancer leaves the prostate, we would start hormone therapy. It's basically a shot every 1 to 4 months, and it takes away a man's testosterone. Testosterone is the food that fuels the cancer. So if we can give you a shot that will take away your testosterone, we're taking the food away so that this cancer doesn't continue to grow. Shots do have side effects, okay? A lot of guys, pretty much all of them, will get hot flashes. They might feel tired. They might gain some weight. That's pretty typical. So hormone therapy is effective, but guys will feel it. So, and guys don't love it, but they can deal with it. It's very manageable. I think hot flashes and fatigue are the most common complaints we see in our practice. One of the new options too is chemotherapy. That came in from one of our online questions. We're using chemotherapy, docetaxel, at an earlier stage for prostate cancer, and we're also using it in the late stages of prostate cancer. Docetaxel has been around the longest, and it's very effective and it works, but it does have a lot of side effects. It is a chemotherapeutic, so it does work. The other new thing that we use a lot of is something called immunotherapy. It's called Provenge, and this represents the new frontier or novel ways to treat any cancer. This was one of the first ways to treat cancer, and it happened to be, thankfully, in prostate cancer. And this technology is incredible. The way it works is you take a man's white blood cells out of his, or antigen-presenting cells, you take out the cells of his body, you take them and you send them to a lab, and then they're reprogrammed. You reinfuse these cells a week later into a guy's body, and what it does is it triggers an immune response so that his body will kill the cancer. So we're using a man's own immune system to kill prostate cancer. It's amazing. It's revolutionary, and it represents the future of most cancer therapies, is using the own immune system to kill the cancer. The nice thing about immunotherapy is the side effect profile is very, very good. The only time it's very well tolerated. The only real problems we see when we use this therapy is that he might get a fever during infusion, but it won't cause hair loss, it won't cause anemia. It's very, very well tolerated. Typically, this is our first step in how we treat advanced prostate cancer. It's 1 month of treatment. We get the immunotherapy in. It's called Provenge, and that leads to a lifetime of using your immune system to kill the cancer. Very effective with not a lot of risk. Another new technology that's not new, but it's improved, is radium-223. It's a radiopharmaceutical. It's made by Bayer, and this technology is incredible too. Basically, it tricks the body to thinking that it's an infusion of radiation. And the nice thing about it is it goes right to the bones. It goes right to the cancer, emits a low dose of radiation, and kills the cancer right in the bones. Okay? It's very safe, very well tolerated. It's 6 treatments over 6 months, And when you look at the data on radium-223, it's very rare that the guy we can control the disease in the bone after he's gotten radium-223. It will improve his survival, and will also is effective in taking away pain. So if you have cancer in your bone, prostate cancer in your bones, radium-223 will take away the pain as well as allow you to live longer. And it's just monthly injections for 6 months. It's very well tolerated, very effective. We're going to be using more and more of this in the coming years as concomitant therapy in conjunction with all our other therapies. Well, there's 2 questions. So combination therapy we typically use with radiation, okay? So there's 2 questions here, and one question is we'll use combination therapy in intermediate or high-grade prostate cancer. We'll use Lupron plus radiation. That's where we'll use it. The question, what I think our online viewer was asking, was Lupron and Xtandi. Lupron and Xtandi would be used in a metastatic setting in a castrate-resistant prostate cancer. Yes, we use combination. When a guy is castrate-resistant, has metastatic disease, we will continue the Lupron and add Xtandi. So we never stop the Lupron in a castrate-resistant metastatic setting. Seems counterintuitive, but we don't have the studies to stop it at this point. It's always safer in those settings when you're dealing with such aggressive disease to use both.